Hello and welcome to the 5-minute videos review for the NCE. Today we are covering clinical focus and we are going to be talking about subheading or subset E, which is caregiver concerns. With this country, and not just this country, but other countries as well, we are having a trend of having an older demographic or older population. And because individuals are living longer, there is a greater need for caregivers. Many times, those caregivers could be hired, but many times a caregiver could be a relative or a family member that, whether voluntary or involuntary, has had the role of a caregiver or a caretaker. Now, this could be either a paid or an unpaid position again, and sometimes it could be voluntary or involuntary. Many times, or most Americans, they retire involuntarily. So most Americans who retire do so because of their incapability of continuing to work. And because of that, many times they are unexpectedly needing a caregiver since they cannot take care of their day-to-day living. So some of the issues with caregivers or caretakers, as you can imagine, are things like stress, isolation, and fatigue. Many times they want to go out or they want to have out and do things, but because of their responsibility, they feel like they cannot, there could be transportation or mobility issues with that. It can also be very rewarding. Many caregivers feel a sense of duty to those that they're caring, but it can also be very stressful and difficult. So you can have a spectrum of emotions that are associated with the notion of caregiving. And again, this group can vary quite a bit based off financial resources, also limitations to health. If someone is still very mobile and can do most day-to-day caretaking, then caregiving would be at at a minimal. Whereas if someone doesn't have mobility or has a lot of health conditions, then the caregiving would require more intensity, and it would require a more work in order to provide that caregiving. Some of the things that you should keep in mind when working with clients who report that they are caregivers are anger and frustration. Again, they want to help, but it's depending on the person that they're caregiving for. It can vary quite a bit, and it can create a lot of frustration and anger. Also, anxiety and fear. Many times when someone becomes a caregiver, he or she can have difficulties with finance, for example, because they're no longer able to work. Also, they may have the fear of death, or suffering. Also, another thing to keep in mind is the notion of depression. 40 to 70% of caregivers experience symptoms of depression. Many times it's due to the isolation, the loneliness, and many times it's because they're not taking care of themselves. And with caregiving, there's a great deal of grief and sadness, grief over things that the person was able to do many times, and now they're seeing that decline. Also, there's guilt involved. Did I do everything possible to care for this person? Was I, you know, able to care for them as best as I could? And finally, some things that you should keep in mind is the physical strain, illness, and exhaustion. For many, they've termed this term the sandwich generation. It's where they're still taking care of the kids, but then they're taking care of the parents as well. So because of that, kind of puts them in kind of a bind of taking care of two generations at once. So that is an overview of caregiving concerns and what some of those themes look like.